surgical suite in the Ontario General Hospital was sterile, the sharp scent of antiseptic mingling with the underlying warmth of machinery. Bright overhead lights bathed the operating table in an unforgiving glare, illuminating the intensity etched on each member of the surgical team. The room buzzed with anticipation, the sound of electronic monitors beeping steadily, tracking the vital signs of the patient. The lead surgeon, Dr. Reynolds, gave dictation on the upcoming procedure.
Upon presentation, the 71-year-old female from the long-term care facility was experiencing a constellation of concerning symptoms, including the production of orange mucoid secretions, hypoxemia, and significant changes in mental status. The initial hypothesis centered around an influenza-like illness given the patient's comorbidities, notably late-stage Alzheimer's disease, which had already impaired cognitive function. These symptoms, including the unusual secretion and oxygen desaturation, were noted to be progressive, raising concerns for a more severe underlying pathology. On initial examination, her oxygen saturation was recorded as being suboptimal, in the low 80s, suggesting hypoxemia. Despite this, initial therapeutic interventions aimed at improving oxygenation, such as supplemental oxygen via nasal cannula, did not yield the expected clinical improvement. In fact, as oxygen levels were increased, the patient's condition worsened, with escalating respiratory distress and paradoxical responses in her vital signs. This unusual deterioration following oxygen supplementation raised concerns for a potential exacerbating condition, which tomography, CT scan, and magnetic resonance imaging, MRI, of the brain. The initial MRI revealed an abnormal mass located within the brainstem, a critical area of the brain responsible for essential autonomic functions, such as respiration, heart rate, and blood pressure regulation. The mass was observed to be approximately 1.5 centimeters in size and exhibited significant hyperintensity on T2 weighted images, suggesting it was either a neoplasm or an abscess. Over the course of the next 24 hours, a follow-up MRI was performed, which showed a marked increase in the size of the mass, now measuring approximately 4.5 centimeters, a threefold increase in volume. Furthermore, the mass had taken on a distinctive rope-like morphology, a pattern that raised suspicion for a central nervous system infection, possibly related to a mycotic or parasitic etiology, or an aggressive neoplastic process like glioma or lymphoma. The rope-like structure suggested infiltration into surrounding neural tissue, which could explain the patient's worsening condition and her unresponsiveness to oxygen therapy. Given the rapid growth and critical location of the mass, an emergency exploratory craniotomy was scheduled to obtain tissue samples for further evaluation and to decompress the brainstem. Preoperatively, the patient's clinical status deteriorated with further hypoxemic episodes and the appearance of new neurological signs such as pupillary asymmetry, signs of brainstem dysfunction, including dysphagia, facial weakness, and irregular respiratory patterns, and worsening confusion. The attending physician sought surgical consultations from a multidisciplinary team, including specialists in infectious diseases, neurology, hematology, orthopedics, and the Public Health Agency of Canada. The collaborative approach aimed to explore all potential causes of the patient's symptoms, considering the complexity of her condition and the rapid deterioration observed despite standard interventions. Infectious disease specialists were consulted due to the possibility of an infection affecting the central nervous system, particularly considering the patient's immunocompromised state secondary to her advanced dementia and possible malnutrition from difficulty swallowing. The orange mucoid secretions, which appeared to be mixed with saliva, urine, and fecal matter, also suggested a possible underlying infectious etiology, such as a fungal or bacterial infection, or even a parasitic infestation. Given the rapid progression of the mass, the infectious disease team recommended additional cerebrospinal fluid, CSF analysis, and blood cultures to rule out any central nervous system infections, such as meningitis or encephalitis, which could present with similar neurological symptoms. In conclusion, despite the administration of ivermectin, a widely used antiparasitic drug, its ineffectiveness in eliminating the parasite suggests potential resistance or other underlying factors. This resistance could stem from genetic mutations within the parasite, altered drug metabolism, or issues with drug absorption in the host. The continued failure of ivermectin emphasizes the need for further research into the parasite's mechanisms of resistance and calls for the development of alternative treatment strategies such as combination therapies or novel drug classes. Ongoing studies are crucial to improving therapeutic approaches and ensuring better management of parasitic infections. Neurology and hematology specialists were brought in to evaluate the potential for a neoplastic process, particularly given the rapid growth of the mass and its aggressive morphology on imaging. The rope-like appearance of the mass raised concern for a glioma or lymphoma, and the hematology team also considered the possibility of a hematogenous spread of cancer, given the patient's age and comorbidities. Neurological consultation also highlighted the potential for mass effect on the brain stem, leading to the observed respiratory dysfunction, dysphagia, and cognitive changes. An urgent biopsy was planned during the craniotomy to determine whether the mass was a neoplastic lesion or an infectious process. Given the complexity of the case, the Public Health Agency of Canada was consulted to consider potential outbreaks or emerging infectious diseases that could present in such an unusual manner, particularly in long-term care facilities. The agency reviewed the patient's medical history and the potential for a rare infectious etiology, such as a novel viral infection or a rare parasitic infection like toxoplasmosis or amoebic encephalitis. They also considered the possibility of environmental factors contributing to the patient's clinical presentation, such as exposure to contaminated food, water, or healthcare-associated infections.
Dr. Reynolds stood at the head of the table, his eyes focused and determined. The patient lay unconscious, intubated and sedated, with continuous monitoring showing a steadily compromised vital state. The anesthesiologist adjusted the gas flow, while the surgical technician prepared the instruments for the delicate procedure ahead. Dr. Reynolds stepped forward, gloved hands steady, as he prepared to make the initial incision along the midline of the scalp. The dura mater, the tough outer membrane covering the brain, would need to be carefully dissected to avoid causing additional trauma. As he performed the craniotomy with a high-speed drill, he ensured that the burr holes were placed meticulously to minimize damage to the surrounding brain tissue. Once the calvarium was removed, Dr. Reynolds was met with a grotesque sight. The parasite, a complex organism with tendrils and fibers that infiltrated the brainstem. The tendrils extended outward, infiltrating neighboring structures, including the midbrain and pons. Each filament pulsated around critical vascular structures, including the basilar artery and the vertebral arteries, illustrating the extent of its insidious infiltration.
"The entanglement is worse than we anticipated,"
he muttered to the team, his brow furrowed in concentration. The fibers snaked down into the cervical spinal cord, where they intertwined with peripheral nerves, potentially compromising motor functions and autonomic control over the host's bodily systems. Dr. Reynolds switched instruments to a pair of fine-tip microscalpels and microdissectors, carefully teasing apart the parasite's tendrils from the surrounding neural tissue. With every motion, he had to balance precision and haste. The longer the creature remained, the more control it exerted over the host's physiological functions. He noted how the organism's tendrils had even penetrated into the medullary respiratory centers, diverting oxygenation and further impairing the patient's ability to breathe independently.
"There's a significant vascular involvement,"
the neurosurgical resident cautioned as they spied tendrils encasing the internal carotid artery. Dr. Reynolds nodded solemnly. Any misstep could lead to catastrophic hemorrhage. Once the brain was adequately exposed, they had to carefully navigate around cranial nerves and important vascular structures to reach the central body of the parasite. With precision, Dr. Reynolds employed diathermy to selectively cauterize the foot-like anchor points that tethered the parasite to the neural tissue, preventing blood loss while ensuring minimal damage to the surrounding neurons. As they progressed, Dr. Reynolds initiated suction through an endoscope in order to clear the surgical field of serosanguineous fluid and debris, allowing for better visualization. This facilitated their access to the primary mass, which was pulsating ominously, almost as if it were alive and aware of its impending removal.
Have pathology get ready for immediate processing.
Dr. Reynolds instructed as the anesthesiologist monitored the patient's declining oxygen saturation. As Dr. Reynolds meticulously closed the dura mater, an unsettling realization coursed through him. The parasite, while significantly diminished in size, was not dormant. Even under general anesthesia, the increase in oxygen levels within the surgical environment had the potential to incite a heightened metabolic state in the creature. The invasive organism thrived on enriched oxygen, a fact that had been alluded to in preoperative discussions, but had not been fully appreciated until now. He watched intently as the anesthesiologist adjusted the oxygen delivery settings. Keep the FiO2 levels around 30%, he instructed. The last thing they needed during this delicate phase was for the parasite to rouse and exacerbate the already precarious situation. However, the patient's oxygen saturation continued to hover precariously, straddling the line between normoxia and hypoxia. The monitors blinked with dual alarm tones, indicating fluctuating saturation levels as if an unseen battle raged. As the surgical team continued their efforts to stabilize the brain after the removal of parts of the parasite, an alarming change occurred. The patient's vital signs began to fluctuate wildly, and moments later, the monitors blared a cacophony of distress signals. The oxygen levels had inadvertently crept higher than anticipated, and the physiologic response from the creature ensconced within the patient's body was immediate and violent. The stillness of the operating room shattered as the patient, previously unresponsive, suddenly convulsed on the operating table. Eyelids fluttered open, revealing eyes that glinted not with the awareness of the person they had known, but with a jaundiced primal ferocity. The host, now fully under the parasite's control, thrashed violently, dislodging cables and monitors as if possessed by an unrelenting force. Within seconds, she lunged toward the closest clinician, a surgical nurse, her hands clawing through the air like an animal driven wild. Saliva dripped from her mouth, a bile-green liquid mixed with odd orange mucus that glistened grotesquely under the operating lights.
Secure her!
Dr. Reynolds shouted, his voice barely cutting through the chaos. But the patient was already on the nurse, gripping her wrist and sinking her teeth into the nurse's arm. She let out a scream of shock and pain, blood pooling and mingling with the vivid orange secretion now oozing from the patient's mouth. The surgical tech rushed forward to intervene, but the patient, now fueled by adrenaline and the parasite's ferocity, turned and struck. Her limbs flailed with uncharacteristic strength, the very instinct for survival twisted into an assault. The chaos escalated as the patient, locked in a battle for control, flailed her arms with a violence that betrayed the frail human beneath. Dr. Reynolds, realizing that time was of the essence, quickly assessed the situation. It wouldn't be long before the team found themselves overwhelmed.
Get security now,
he yelled, but there was no time to wait. The aggressive thrashing had sent medical instruments skittering across the floor, and despite the anesthesia still in her system, the parasite's grip was stronger than anyone had imagined. The surgical tech dropped the instruments and smashed the code button on the wall. Code Violet, the code for a violent combative patient. The hospital's intercom blared, Code Violet, OR, Code Violet, OR. The moment the alarm rang through the building, panic gripped the heart of the operating room. Dr. Reynolds and his team were already on edge, struggling to contain the patient, who had gone from unresponsive to an out-of-control, violent force in a matter of seconds. The patient, her body twisted and contorted unnaturally against the restraints, was a vessel of the parasite's brutality. Her eyes were wide and feral, no longer the eyes of a human being, but those of a monster. She jerked violently again, thrashing her head side to side as if she could tear herself free from the shackles holding her down. The monitors screeched, flashing warning signals for the fluctuating oxygen levels. But none of that mattered anymore. The team's efforts to stabilize her were futile.
Hurry!
Dr. Reynolds barked. His voice was sharp, almost frantic. His hands trembled as he grabbed at the surgical tools in front of him, but nothing felt like it would help. The parasite inside her had taken control. He could feel it. There was nothing left of the woman who had once been.
We need security! Now!
He shouted. The moment he did, the door to the OR burst open. The first security guard entered, his footsteps heavy and filled with urgency. He had been prepared for something dangerous, but nothing could have prepared him for what was unfolding in front of him. The patient's mouth was foaming, her hands still shackled but pulling violently against the restraints. Dr. Reynolds barely spared him a glance as he continued to monitor her vitals, his mind racing.
What the hell is going on in here?
The guard shouted, taking in the scene of blood and chaos. Before anyone could answer, the patient, her eyes now glowing with the feverish intensity of the parasite's will, suddenly snapped. In a blur of motion, she yanked her arm free from the restraint. Her hand shot out like a whip, grabbing the guard's wrist with terrifying strength. He grunted, struggling to free himself, but she was faster. Her mouth opened wide, revealing jagged, blood-stained teeth. The guard barely had time to react as the patient lunged forward, sinking her teeth into his throat. He gasped, shock and pain mixing in his eyes. As blood gushed from the wound, he let out a strangled cry, his hands scrambling at the patient's face, trying to pry her off. But she wouldn't let go. Her jaw locked like a steel trap, tearing into his flesh with a grotesque squelch.
Jesus Christ!
One of the nurses screamed, stumbling back against the instrument tray, sending scalpels and clamps clattering to the floor. Dr. Reynolds recoiled, his mind blank with horror. The patient was still restrained by her other arm and legs, but it didn't matter. The damage was done. The security guard's body convulsed before going limp, his knees buckling beneath him as he collapsed onto the cold, sterile floor. Blood pooled around him in an ever-growing crimson halo.
We have to get out of here.
Another nurse cried, her voice shrill with panic. But before anyone could move, another nurse, Maggie, rushed forward in an act of desperation. She reached out, instinct taking over, her hands grasping at the guard, trying to drag him back. That's when the patient turned on her with terrifying speed. The moment Maggie's fingers brushed against the guard's shoulder, the infected woman wrenched her head free from his torn throat and lunged. Maggie barely had time to react before the patient's teeth clamped down onto the soft flesh of her forearm. A scream ripped from her throat. The pain was immediate, searing onto the operating table. Maggie instinctively yanked her arm back, but the infected woman held on with unnatural strength, her jaw locked like a predator refusing to release its prey.
Help me!
Maggie shrieked, eyes wide with terror, as she struggled against the iron grip of the dying, or already dead woman. Dr. Reynolds acted without thinking. He grabbed a nearby scalpel and, with a desperate swing, slashed at the patient's arm. The blade bit deep, severing tendons and muscle, forcing the creature to loosen its grip just enough for Maggie to stumble free. She fell backward, clutching her arm, crimson spilling between her fingers. The wound burned, the flesh already looking sickly pale around the ragged bite marks. The door burst open again, and a second security guard stormed in. "Get back!" he shouted, his eyes darting between the writhing patient and the fallen guard. He barely had time to process the horror of the scene before he focused on the still thrashing woman on the table. She was half unshackled now, her mangled arm hanging half useless. But it didn't slow her down. Her remaining restraint creaked and groaned as she bucked wildly, foam and blood dripping from her lips. Her fingers clawed at his face, her nails raking deep, leaving bloody trails across his cheek. The guard recoiled, stumbling backward, his arms coming up in a weak attempt to shove her away. But she was relentless. With terrifying speed, she lunged, her teeth sinking into the soft flesh where his neck met his shoulder. The guard howled in agony, thrashing against her grip, but she latched on like a rabid animal, tearing and ripping at his flesh. Blood sprayed across the sterile white walls of the OR, the scent of iron thick in the air. "Get her off him," Dr. Reynolds shouted, but no one moved. The remaining staff stood frozen, paralyzed by sheer terror. Maggie clutched her own wounded arm, her breath coming in rapid, shallow gasps. The guard, now gurgling, his knees buckling, struggled weakly as the infected woman bore him to the ground. She ripped another chunk from his neck, her face a grotesque mask of blood and gore. His body spasmed once, then went still. The patient, no, the thing lifted its head, blood dripping from its chin, eyes wild and empty. It wasn't satisfied. It wanted more. And it turned its gaze on them. As the blood-soaked creature lifted its head, ready to pounce on its next victim, a nurse, acting purely on instinct, grabbed a towel from the nearby tray. With a desperate cry, she lunged forward, coming in from behind, and whipped the towel around the infected woman's face like a garrote. The cloth wrapped tightly over her mouth and nose, muffling her frenzied snarls. The nurse wrenched it back with all her strength, her arms trembling as she fought to keep the thing restrained.
Do it.
She screamed, her knuckles turning white as the infected woman thrashed against her grip. Dr. Reynolds didn't hesitate. His hands, still slick with blood, fumbled for the scalpel. With the towel tightly wrapped around the patient's face, muffling her growls, Dr. Reynolds stepped forward, his heart pounding in his chest. The nurse holding the towel was struggling to maintain control, her hands slipping as the patient bucked and twisted with terrifying strength. The towel was now soaked in blood, sticking to the patient's skin like a second layer. Dr. Reynolds steadied his breath, his hands shaking as he raised the scalpel high.
"Stay still,"
he muttered to himself, the words barely audible over the chaos. With a deep breath, he plunged the blade downward, aiming for the back of the patient's neck. The scalpel sunk into flesh with a sickening squelch, and he pushed it deeper, his knuckles white from the effort. He felt the resistance of bone, but he kept pressing, twisting the blade to cut through the spinal cord. The infected woman's body spasmed violently, her legs kicking and arms thrashing as she let out a strangled, garbled scream. The nurse holding the towel cried out, almost losing her grip, but the doctor didn't stop. With a final, brutal twist, he severed the spinal cord. The woman's body went limp, her muscles twitching once, then relaxing entirely. For a moment, there was a terrible silence. The only sound was the ragged breathing of the nurse and the soft drip of blood onto the sterile floor. Dr. Reynolds stood frozen, the scalpel still gripped tightly in his hand. His gaze was fixed on the lifeless body in front of him. He wiped the sweat from his forehead with the back of his hand, his pulse still racing. For a moment it seemed like the nightmare was over. But then the infected woman's mouth, still covered by the towel, snapped open, her jaw contorted in an unnatural way, her teeth gnashing wildly beneath the fabric. The nurse holding the towel screamed and jerked back, but the woman's hands shot up, grabbing her wrists with horrifying strength. The nurse struggled to break free, but the woman's grip was like iron, pulling her back toward the now quiet body.
No.
The nurse cried out, fighting. The patient's eyes, wide, wild, and filled with a sickening hunger. The nurse's arm trembled as she tried to break free, but the infected woman, even with the spinal cord severed, was still alive. Dr. Reynolds reacted instinctively. His mind raced as he saw the nurse's struggle. Without thinking, he grabbed a nearby surgical clamp and lunged forward. With a sickening crack, he smashed the clamp into the back of the woman's skull, the sound reverberating through the room like thunder. The woman's body twitched violently, her grip loosening just enough for the nurse to yank her arms free. But she wasn't done. Her body jerked upward again, her head lurching with unnatural speed. Her mouth was wide, snapping at the nurse, who was still reeling from the shock of the sudden attack.
"Get out!"
Dr. Reynolds yelled, pulling the nurse back, his voice shaking. The nurse stumbled, scrambling to the door, blood dripping from her hands, her face pale with terror. But before she could reach safety, the woman, what was left of her, lunged one last time. The force was enough to send the infected woman crashing into the nearby operating table, knocking instruments to the floor in a violent clatter. Her body twisted and convulsed as though the parasite controlling her was refusing to let her go. The doctor could see it now. She wasn't just fighting for survival. She was fighting to spread it. Dr. Reynolds stepped back, eyes wide with realization. The creature's ability to function, despite the damage, despite the severed spinal cord, was terrifying. It wasn't human anymore. The nurse made it to the door, slamming it shut just in time to block the woman's final, futile attempt to reach her. She gasped for air, her face white with the horror of the near miss. Dr. Reynolds stood frozen, the weight of what had just happened crashing down on him. The creature, still twitching and convulsing on the operating table, was beyond saving. It wasn't human anymore. It was a vessel for something much worse. He could feel the terror building in his chest, but his hands were steady now. The patient, if she could still be called that, was done. There was no hope for her, no more humanity left. He glanced over at the nurse, who was trembling against the wall, her eyes wide with shock. She was still breathing hard, but her hands were shaking uncontrollably, covered in blood. Dr. Reynolds swallowed hard. He had to end it. There could be no more hesitation. Moving with precision, he reached for a surgical knife. Something sharp, something that could get the job done quickly. He was no stranger to making hard decisions, but this was different. This was more than just a patient. This was the embodiment of everything that had been unleashed on the world. The woman's body jerked again, spasming violently, and the sound of her jaw snapping open and shut echoed in the room like a grotesque mockery of life. She wasn't dead, not yet. The parasite inside her wouldn't allow it. Dr. Reynolds moved swiftly, stepping toward the table. His face was grim, the horror of the situation etched deeply in his features. He couldn't afford to flinch. He couldn't afford to hesitate any longer. He positioned himself behind the patient, gripping the scalpel tightly in his gloved hand. The creature's body flailed in an almost rhythmic pattern, the eyes rolling back into its head as if it knew the end was coming. Without another thought, Dr. Reynolds plunged the blade deep into the back of the patient's skull, aiming for the brain. The creature's body twitched again, violent, reflexive, but this time it didn't rise.
Is anyone still breathing?
He called out, his voice hoarse. The nurse who had been bitten was slumped in a corner, clutching her torn arm. Her face was pale, the shock settling in as she tried to stem the flow of blood. Her gaze flickered up at him, eyes filled with a mixture of disbelief and fear.
I can't feel my arm.
She whispered.
Stay with me,
He said, rushing over to her, grabbing the trauma kit from the counter and tearing it open. You're going to be okay. The surgical tech was barely conscious, sprawled on the floor beside the first guard. His breathing was shallow, his hands clutching his bloodied face. One of his eyes was swollen shut, and the other flickered with barely enough life to focus. Dr. Reynolds knelt beside him, applying pressure to a wound on the massive laceration on his face.
You're gonna make it. Just stay with me.
He barked, trying to force the words through the panic rising in his chest. His hands were slick with blood. He wasn't sure if it was his or theirs anymore. But then, his heart froze for a moment. He glanced back at the first guard. The first guard, the one who had been mauled by the patient, he was still twitching on the ground. His body was a bloody mess. The patient's teeth had torn into his throat with brutal precision, and the life was draining from him quickly. The guard's blood pooled around him, staining the tiles beneath him a deep red. His hand twitched as if he was trying to move, but he was already too far gone. Dr. Reynolds' stomach churned. He stepped over to him, trying to check his pulse, but there was nothing. The guard's body lay still, his chest no longer rising and falling. Dead. There was no time for sentiment. The team had lost too many already. The first guard was gone, but there was no time to mourn. The nurse was barely holding on. The tech was fighting to stay conscious, and another guard had already fallen to the patient's violent attack. The room felt like it was closing in on him, suffocating him with the weight of the loss. But he couldn't afford to lose focus now. He couldn't afford to waste time. The second guard, still twitching, was fighting for his last breath. His eyes flickered open, a frantic desperation in them as he looked around the carnage, clearly trying to process the nightmare he had just witnessed. His hands, slick with blood, reached out weakly, grasping for something, anything, but he wasn't going to make it. Dr. Reynolds took a deep breath, steeling himself. There was no more time for hesitation. He moved swiftly to the second guard, kneeling beside him. The man's eyes locked onto his with a plea that was more primal than human.
You're done,
Dr. Reynolds muttered, voice rough, almost detached. He didn't want to say it, but there was no denying the truth. The second guard's injuries were too severe, too deep. With one last glance at the guard's struggling face, Dr. Reynolds closed his eyes for just a moment, then did what he had to do, ending the suffering before it could continue. The room fell into a heavy, suffocating silence. Dr. Reynolds stood, his body soaked in blood, his hands shaking. His chest was tight with the weight of the carnage. But it wasn't just the bodies in the room that weighed on him. The world outside these walls, if it even still existed, was collapsing. There were no more safe places, no more guarantees. He was running out of time, and the terror of what had happened in that room was only a fragment of the horrors unfolding elsewhere. The infection, the outbreak, what he had seen here was just a small piece of a nightmare that was bigger than any of them. As more nurses and doctors poured into the OR room to treat the surgical team and get them downstairs to the ER, and becoming infected themselves from all the bodily fluids in the room, Dr. Reynolds leaned back, wiping the sweat from his brow.
God help us.
He whispered almost to himself, but deep down, he knew the worst was yet to come.